Hello everybody, nutritional scientist Lee McCauley here, and in this video I want to discuss the global economic burden of obesity. Now, it's sort of been well discussed, the physiological burden or the pathological burden of obesity, its effect on your health and its ability to create disease essentially. That's been well discussed. Everyone, unless you're completely incompetent, would understand that. But in this video, I want to discuss the global economic burden of obesity. Okay, and for reference, I just have an article here that I've written just to help me along the way and help you guys sort of get a gist of what I'm talking about. Okay, so the economic burden of obesity includes direct and indirect costs. Okay, and when I'm talking about the economic burden of obesity, I'm talking about the financial aspect of obesity, how much it costs the healthcare system, how much it burdens countries, the healthcare costs associated with it, the employment you have to do because of it. You have to employ doctors, nurses. You have to have these hospitals. Someone has to build them. An engineer's got to work that out, right? All of these costs. Okay, so you have these direct costs and these indirect costs. So direct costs refer to medical expenses related to obesity, such as hospitalizations, medications, and visits to health professionals. Okay, and that's pretty easy to grasp, right? Okay, you're obese. Okay, you have some comorbidities. Maybe you have cardiovascular disease, diabetes, right? You can get hospitalized. You could have stroke, heart attack, right? Medication costs, beta blockers, statins, things like this, and visits to health professionals, seeing your GP, dietitians, cardiologists, so on. Okay, that costs money, right? But there's also these indirect costs, which refers to the impact of obesity on economic productivity. Okay, such as absences from work because you're too sick to work. The disease is affecting your ability to perform. Okay, so inefficient job performance. When you're dealing with all these symptoms of disease, it's quite difficult. Your cognition's going to be affected, your ability to sort of get around at work, you're going to be a little bit more inefficient, right? And earlier of time and due to disability. Okay, so disability can be brought upon about the debilitating side effects of obesity. Okay, or even premature death. Okay, so it goes without saying, your ability to work declines quite rapidly if you're dead. Yeah. So obesity also increases the risk of developing other chronic diseases, okay, such as diabetes, heart disease, and many cancers, okay? So then you're going to have the economic burden of trying to treat all those diseases, going to see a cardiologist, going to see an oncologist because you have cancer associated with diabetes, okay? With obesity, okay? Which further increases the global economic burden, right? All of this is costing our economy massive amounts of money, okay? But how much money, you might ask, right? Okay, so the global economic burden of obesity is quite staggering, really. So a study published in The Lancet in 2017 estimated that the global cost of obesity is 2 trillion annually. Okay, not 2 billion, not some Jeff Bezos money. We're talking about like the market cap of Apple here. Okay, we're talking 2 trillion, the biggest company in the world. Okay, this is a massive amount of money. Okay, and this is equivalent to 2.8% of the world's gross domestic product. Okay, GDP. Okay, this is a humongous amount of money, and inefficiency is wasted on a disease which is relatively can be controlled, right? If governments step in, something can be done here. Okay, this is very concerning stuff. Okay, the study also found that the cost of obesity is highest in high-income countries, where it accounts for up to 5% of the GDP. Okay, and this typically because they have more access to food, more resources, more agriculture going in countries like the United States of America. There's more food, there's more access, there's more advertisement for these type of foods that are associated with obesity. Your fast foods, your high sugar, high fructose corn syrup products, things like that. Okay, so the United States, which has one of the highest obesity rates in the world, I believe it might actually have the highest, incurs the highest economic burden with an estimated cost of 480.7 billion in 2015, and that's USD. Okay, so unbelievable amount of money. Like we're talking Elon Musk times 3. Huge amounts of money. Okay, and so the economic burden of obesity affects not only individuals and their families, but also society as a whole. So you can imagine this money. Think about all the other things it could be spent on. It could be spent on school, roads, all kinds of things, productivity. It could be spent at universities, coming up with new technology. But no, we're just spending it to just try to treat a condition that doesn't really have to occur, right? Okay, so for example, obesity-related healthcare costs can strain already heavily strained healthcare systems, especially healthcare systems that have just been strained massively from the COVID-19 pandemic. Okay, so this can lead to higher health insurance premiums. So you got to pay more to get your health insurance because they don't trust you. They don't want to insure someone that they think is going to drop dead, right? So those premiums go up, and reduce access to medical care because there's so many people accessing medical care. There's more lineups, there's more waiting time, there's more, it's just burdens the whole healthcare system. Okay, to treat this disease that really shouldn't be occurring. Okay, reduced productivity due to obesity can also lead to lower economic growth and scientific advancement. Right? Okay, because if people are unhealthy, they're not able to go study. Their productivity is lower. It really sets the world behind. That's essentially what obesity is doing. Okay, and higher unemployment rates associated with the side effects that obesity occurs, okay, and the comorbidity diseases associated with obesity. Okay, so not only should politicians be taking notice, but all of society should be recognizing the burden of obesity. Okay, and there's a nice little quote that I put up here. Okay, I'll just exit off that. An ounce of prevention is worth a pound of cure. Okay, and this is completely true. Okay, at the hospital, they cure people. Okay, when you already have the disease, okay, you have that disease, they treat it. Okay, so they won't really cure you; they'll treat that. Okay, but if you have the prevention, okay, you don't need to cure the disease in the first place. Okay, we need to prevent obesity. Okay, once it has already occurred, very difficult to treat, but we need to start preventing these levels from increasing, which they are. Okay. And I just want to look at a few stats that I have here. Okay, so we can look here. So worldwide obesity has nearly tripled since 1975. Okay, this is very concerning stuff. In 2016, more than 1.9 billion adults 18 years and older were overweight. Of these, over 650 million were obese. Okay, and you can imagine the economic burden for this. Okay. Okay, we look over here. So obesity is responsible for around 5% of all global deaths. The global economic impact from obesity is roughly 2 trillion, as I said earlier, or 2.8% of the global GDP, roughly equivalent to the global impact from smoking or armed violence, war, and terrorism. Okay? If you're anti-war, you need to be anti-obesity, okay? Listen here, folks, I'm telling you. Okay, the impact of obesity on annual medical costs in $2005. Okay, bit of inflation since then. Let's be honest, it's like 10% a year. So take this with a grain of salt. But is estimated to be $2,741 for men and women pulled together. So 3,613 for women and 1,152 for men. Okay, so it seems to be mainly affecting women here. So these averages are driven by relatively new individuals, few individuals with very high BMI and very high medical expenditure. So we do need to take note of that. This isn't statistically significant. Okay, P value higher than 5. Okay, but this is just a little bit of evidence, just showing you this burden. That's basically all for this video. I will discuss this topic more in future videos. But I hope you've all sort of learned a little bit about the economic burden of obesity. Thank you, and I'll see you in the next video.